Hi, it's Christina with the Sisyphean Journal. Today is July 23rd. I'm going to provide a link to the anniversary for today because I already covered it. We're going to go back to looking at Gideon Kioko. He is the abortionist responsible for the deaths of Debra Gray and Susanne Logan. I'll provide links to their stories below. But we're looking at medical board documents regarding other patients. I'll provide links below. I already covered in general the condition of his private practice. I covered the horrible care he gave a patient identified by the medical board as patient A. Now we're going to look at what happened to patient B on January 29th of 2005. So this is from medical board disciplinary documents. So on January 29, 2005, patient B, a 30-year-old female, presented to respondent on referral from Potomac Family Planning. I'm going to pause here. What is Potomac Family Planning? Why were they referring to Kioko? Hold on just a minute. Okay, I looked it up. I will provide a link below. Evidently, Potomac Family Planning has kind of grown. They run Hillcrest of Baltimore, which is not exactly a savory place. Hagerstown Reproductive Services, which referred Desiree Hawkins to Kermit Gosnell, if I recall correctly, and a place in Rockville, Maryland. And Earl McLeod works there. So there have been other bad circumstances related to Potomac Family Planning. So let's get back to what it is Potomac Family Planning referred patient B to enjoy. So patient B completed an intake form on which she noted she had 3 previous pregnancies which resulted in 2 abortions and 1 miscarriage. Patient B did not complete the portion of the reform regarding allergies, current medications, or history of medical conditions. This is something where Kioko should have said, look, we need to go over this. We can't just skip this. It's important. Respondent did not document any gynecological history regarding patient B, including the dates of the previous pregnancies and procedures. During the investigation, respondent reported that he does not always document a history and physical. A little lackadaisical there. Respondent documented a pelvic examination and noticed that the gestational age of the fetus was 18 plus weeks. Respondent reported to the board staff that he determined fetal age by sonogram that he performed in his office. Respondent or his medical assistant documented patient B's vital signs. Patient B's medical record in respondent's office did not contain a sonogram or documentation of fetal measurements. This guy is sloppy. Later, respondent reported to board staff that patient B brought a sonogram with her from another physician. So, respondent documented that he performed a paracervical block using xylocaine. The cervix was grasped and dilated, and a 16-millimeter suction tip was used to aspirate the uterine contents with difficulty. Respondent reported that he suspected uterine perforation and possible bowel injury. Respondent documented that the procedure was terminated at about 3:00 p.m. and that patient B was transferred to Prince George's. So at least he transported her to the hospital. I gotta give him credit for that. However, according to records from Prince George's, respondent transported patient B to the hospital in his own car. He didn't call 911 for his patient. What was he going to do with her in his car if she stopped breathing? CPR with one hand while he's driving? Patient B presented to Prince George's at approximately 7 p.m. So 3:00, 4, 5, 6. Why is it taking 4 hours to get her to the hospital? It's not that far away. She had a uterine perforation. Said there is no explanation for the 4-hour gap between when respondent terminated the procedure and when patient B presented to the emergency department. Well, that's no surprise. In his operative report at Prince George's, respondent stated, during aspiration, it became apparent that there was a uterine perforation and possible bowel injury. The procedure was immediately terminated. Respondent requested a surgeon to assist with patient B because he suspected a bowel injury. Gotta give him credit for that, at least. The surgeon's postoperative report states that his postoperative diagnosis is perforated uterus with transaction of the retrosigmoid colon and extensive laceration of the left colon and upper rectum and perforated urinary bladder. Surgeon performed a left colectomy and a colostomy with repair of urinary bladder perforation. So he really ripped up her innards. Respondent performed exploratory laparotomy, histocotomy, I'm not sure what that is. Removal of fetus and placenta. So he does all this and he doesn't even get the baby out. And repairs to the uterus. Patient B was discharged to home from Prince George's on February 6, 2005. So she went in for the abortion on January 29th and was released on February 6th. So she spent about a week in the hospital. So, summary regarding emergency action. In the above investigative facts regarding respondents' office conditions and procedures in respondents' care and treatment of patients A and B constitute extraordinary circumstances requiring immediate suspension of respondents' license to practice. Based on the review by the board's experts, the facts that imperatively require emergency action are not limited to the following. Failure to sufficiently monitor patients in that he performs outpatient abortions without adequate number of qualified personnel available to assist, monitor the patients, and assist in emergency. Performs abortions without an adequate medical history and physical examination, fails to sufficiently document preoperative assessments, performs outpatient abortions under local anesthetic without knowing if the procedure can be safely performed by documenting the size of the fetus, performs outpatient abortions without emergency resuscitative equipment, including ambubag, IV setup, laryngoscope, endotracheal tubes, epinephrine, Benadryl, and oxygen cylinders. Now remember, this is after he had 2 patients die from anesthesia screw-ups where they did not resuscitate them. Now, I'm not 100% sure that he knows that Susanne Logan dies. I mean, he got the snot suit out of him, so I assume he knows that she was severely and debilitated. She was left mute and paralyzed in a nursing home. She died right after she won the lawsuit, and I don't know whether he even knew that she died because, frankly, I don't think he cared. Performs outpatient abortions without having office policy or procedures for emergencies. No emergency backups. Failure to maintain a sterile field by reusing the aspiration tube for successive patients. Reusing aspiration tubes until they are opaque, using KY jelly from an unsterile tube, fails to monitor patients after abortions, inappropriately administers medication by injecting it intramuscularly rather than intravenously, inappropriately administers agents such as Metrogen by injecting it transvaginally into the cervix rather than intramuscularly, fails to submit the aspirated contents of the uterus to a laboratory for pathological evaluation, and then some little smaller things. And so where's some other complaints they have about him? See, this patient A. Yeah, patient A, I'm going to link below to the video about her. The power was out, and he's like, oh, okay, you know, when the electric's running, we'll work on the abortion, and we'll stop whenever the power goes out, and then we'll start again. So, so that was patient A. Failed to stop the abortion procedure on patient B when he suspected a bowel injury, notify paramedics, and arrange for transport by ambulance. So, just basically, they ripped him a big one. But the point I really want to highlight is he had Debra Gray die, and he knew that Susanne Logan had been left debilitated, mute and paralyzed in a nursing home, thousands of miles from home, and he still was operating under these shabby, slipshod conditions. Just appalling.